Suction, nose jobs, breast augmentation. Cosmetic surgery is a booming business. But you may be surprised at who many of the new patients are. Teens.
Ever since I was little, kids would say things in school like, oh, you have a big nose, or oh, you have a beak.
It was that kind of teasing that made Tiffany Carreri first notice her nose.
Every time I looked in the mirror or from the side, if I was trying on clothes, those three-way mirrors, I was just like, oh gosh, I hate it.
So at age 18, she had a nose job. Here's a look before and here's a look after. A few months later, Tiffany started thinking more and more about the size of her breasts.
And I felt like if I was running down the beach with a hat on and like a shirt off, no one would be able to tell that I was a woman.
So after lots of research on the surgery and on doctors, she had her breasts enlarged and went from an A cup to a full C, small d. Tiffany is part of a trend, teens in record numbers having plastic surgery. Her surgeon, Dr. Brent Moelleken, but he wants teens and their parents to know it's not something to be taken lightly, especially breast augmentation.
They're not fully developed by the age of 17 or 18, so we wouldn't want to do a breast augmentation on them at that age. But there are people who are fully developed at that age, maybe 18.
Even if a teen is physically ready for surgery, are they emotionally ready, since it may not end with just one operation?
We think as doctors that you'll just have one surgery and that'll be it. You won't have any more problems. But with breast augmentation, that's not the case. The revision rate is 30% at 2 years.
What is that the result of?
That could be a scar forming, an implant failure, an infection. The person wants to go to a larger size or a smaller size.
As for the nose, fewer costs, fewer complications, if you're in the hands of a skilled surgeon.
Once people are fully developed, and the nose is pretty much fully developed by 15 or 16, it's okay to do nasal surgery.
Another very popular procedure for teens, liposuction. And Dr. Moelleken says physical development is less of a factor.
Because when we remove fat, there's no evidence that we actually alter development.
Two other common teen surgeries, breast reduction and ear pinning. Doctors say younger people with these attributes often experience lots of teasing.
And this is a big problem for them socially as well as physically. So they're candidates for breast reductions even though they're only 14 or 15 or 16. People who have very prominent ears can even have the surgery before they're teenagers.
Like at what age?
Maybe even 8 or 9.
As for Tiffany, she couldn't be happier with her body and her new wardrobe.
Like, I love buying, shirts, and I think they look good, and I think they make me look, feminine.
Also, any patient under the age of 18 must have parental consent. Dr. Moelleken says many parents actually push their children into certain cosmetic procedures, which can ultimately damage the child's self-esteem. For more information on this, you can go to our website at kcal9.com and just follow the links.